Welcome, everyone. Thank you for joining the Doctor Journey Step 1 webinar. So today we're going to give you a lot of great content on exactly what you need to know for Step 1 and what one of our best tutors is doing. So just a brief recap, the Doctor Journey is a group of medical students who have excelled on their board exams, gone through medical school, and we want to give back to medical students and who are in our footsteps. So we want to give back, and today we have one of our great tutors, Bhagwat Maheta. He's a 270 plus step 2 scorer and all honors med student, never got less than honors his whole med school career. And we're going to dive into how you guys can study, how to ace your step 1 exam, and any questions you have, we'll answer them at the end. Please enjoy today.
All right. Good evening, everyone. Thank you all for joining. We're excited to spend our Saturday evenings with you all just to talk a little bit about what step 1 is, how to kind of go through it, how to think about it, more importantly, what you guys can do to set yourself up, regardless of where you are in your medical school career, whether you're about to start medical school as an M1, or you're going to be looking at this test in a couple of weeks, or maybe next year, if you're about to start your M2 year, wherever you are in your medical school journey. Hopefully this kind of introduction talk will kind of give you an overview of what this exam entails and how to prepare for it. And then we can go through any specific questions you guys might have at the end. I'm happy to stay on and answer questions that you want to pose to the group, or if you have like more personalized questions, happy to set up a breakout room and we can kind of go into that. But a little bit about me really quickly. I'm currently a 4th year medical student, planning to apply into general surgery this upcoming cycle in a couple of months. I have a passion for surgery because I really enjoyed my research, where I focus on integrating palliative care into surgery with the goal of improving patient quality of life in the long run. And so my goals are to become a surgeon scientist, prioritizing my career to advancing the science around improving quality of life in the surgical field. I love mentorship in particular because throughout undergrad and med school, I have been tutoring others, and I think it's an amazing way to give back. One of the best stories I've heard that actually I experienced about 3 years ago, I started working with a research mentor at Stanford, and she spent a lot of time kind of teaching me everything, how to do the basic stuff, going from how to read a research paper to how to think about methodology, how to communicate what you want to get done with your objectives and research question. And she walked me through everything step by step. And I learned a lot very quickly. And then the next year, we had a couple of undergrads working with us, and she told me, you should mentor one of them and kind of go through everything with them, teach them the way I taught you. And I said, that sounds good. Happy to do that. And so we were working on one of the projects, and towards the end of the summer, I was going to start my M2 year in like a week, and we'd gone through multiple kind of rounds of edits, and I gave her very specific feedback. She worked on it. It wasn't to where I wanted it to be, so I gave more feedback, and we went back and forth a lot of times. And then my mentor asked me, what's the update on this? When am I going to be able to see it? And I said, if you just let me do it, I can get this done. It'll be done by the end of the day, and we can move on. It'd just be so much easier for me to do it. And she told me to stop for a second. And she said, remember last year when I started working with you and I did everything with you step by step? It would have been easier for me to just do it. But taking the time to be able to teach you how to do this allows you to essentially grow into this position. As you keep getting more and more education, you're going to be able to do the same things I'm able to do. And so the impact I'm able to have on patients, I can maybe impact 1,000 patients in my career or 10,000 patients. But being able to mentor someone else to be able to do the same things, you're able to impact way more lives. And that kind of stuck with me. And that's something that I really try to integrate into everything I do, whether it's tutoring for STEP or for teaching, like regular preclinical stuff, or if it's in the clinical rotations and teaching other medical students how to do basic procedures or things like that. I think it's something that's incredibly important. In my free time, I love watching basketball, NBA, NFL. Steph Curry is my favorite player. Team USA is playing, and I think we're going to win it all in the Olympics this July. But now going on to why you guys are all here. What is step one and why are we taking step one? Step one is the foundational United States medical licensing exams. And a lot of people think of it as you're learning a bunch of preclinical stuff that may not be applicable to you 10 years in the future when you're a resident physician or when you're an attending physician and you're taking care of patients. A lot of the stuff you cover in step one with the enzyme reaction, some of the basic science, you may not be using it in your day-to-day life. So what's the point of taking step one? The truth is it helps set a strong foundation as you go into your clinical years. Learning about the different treatments, as well as being able to identify what is the actual pathology that the patient has that we can treat. It comes from the knowledge you develop through your step one training. Of course, it's a licensing exam. It's one of 3 licensing exams that you guys need to become credentialed physicians here in the US. And so typically step one is done between your 2nd and 3rd year of medical school. Step 2 is typically taken between your 3rd and 4th year of medical school. And then step 3 is typically done within your intern year of residency, your 1st year of being an actual doctor. Step 1 was recently transitioned to being a pass-fail exam. And so because of that, a lot of students have been putting less emphasis on step 1 because there's no score associated with it. And so they feel that you can just, show up, take the test, and move on with your life. But the truth is, step 1 is actually an incredibly important test. Struggling on step 1 makes it a lot harder to perform as well as you might want during your clinical years where you are taking care of patients, you are responsible for saving patients' lives. And so all of the fundamental knowledge you develop, learning from step 1, those building blocks will allow you to transform from like a baby doctor that you are right now, still learning, still kind of growing all of your knowledge, to a proper doctor that's able to take care of patients every day. So the basics of this test, it's the first of the 3 USMLE tests. It's a 7-hour test. And so there's 7 blocks of 40 questions per block. Each block gives you about an hour. And then you are not allowed to kind of take a break in between a specific block. But once you finish a block, you're allowed to take a break. In total, you have 1 hour of break time that you're allowed to put wherever you want. The way I kind of approach my test taking, I did kind of the same thing for step 2, which I took about a month and a half back. Step 2 is actually an 8-hour test with 1 hour of break. So it's about an hour longer than step 1. I tried to do 2 blocks together without taking a break, just because I felt like early on I had a little bit more energy. So I tried to knock out 2 blocks at once. Then I took like a quick 10-minute break, went to the bathroom, had a quick snack. Then I did another 2 blocks, 2 hours. At that point, I was a little bit more tired and it was like lunchtime. And so I'd take like a 20-minute break, have a little bit of a fruit, a little bit of food. I usually had a sandwich. Then after lunch, I would do 1 block, take a break, 1 block, take a break, 1 block, and then finish the test. I personally like that strategy just because earlier in the testing day, I had a little bit more focus. I was able to go without having a break, which allowed me to take more frequent breaks towards the end when I tend to get a little bit more tired of taking this long test. But I think everyone has a different approach to how they want to do the breaks and how they want to plan it out. And so my biggest recommendation for this is to practice the way you want to do it on test day. When you're doing your practice, and obviously it's hard to do a full practice test every day. So once a week or whenever you're taking your practice test, try to plan it out based off of when you want to take the breaks. And try to do it like testing environments. So maybe putting your phone away and not looking at it until after the test. Going to the bathroom when you feel like, I finished my 40 questions for the block. I'm taking a break and then I'm going to go to the bathroom instead of going to the bathroom at question 20 just because you had to go. Trying to mimic the testing environment as much as possible. Now, the NBME defines step 1 as step 1 is constructed according to an integrated content outline that organizes basic science material along 2 dimensions, systems and processes. And so essentially it's a test for your basic science understanding and what we typically consider preclinical. So what you are going to be tested on is essentially the entire human body, But from a preclinical standpoint, some questions are going to ask you, what is the diagnosis? What is the drug that you're going to use to treat it? Or what is this, next step in management in terms of, how would you manage this patient? There's going to be ethical questions where they ask, what is the next right thing to say to this patient? So it's a whole host of different things, but kind of fitting it into the overall picture of becoming a doctor. Step one focuses on the basics. What is the actual mechanism behind this pathology, right? Even if the question is asking you, what is the drug to treat it? To answer the question, you need to be able to understand what is the basic behind why this is happening in the first place. And so really getting that preclinical knowledge strong is what's going to help you the most for your step one. Step two starts to go into more of that clinical side of medicine, where it's going to ask you, what is the next best step in management? Or what is the next test that you might order to help diagnose this condition? And so in order to be able to answer those questions, having a strong fund of knowledge from step one, from your preclinical years, understanding what is the pathology, what causes the pathology, is going to allow you to answer those questions much easier. And the reason why I emphasize that is because even though step one is pass fail now, step two is a scored test. And so residency programs will be looking at that score when it comes to, what residencies you might be applying to and what residencies or specialties you might be competitive for. And so really strengthening your step one knowledge is going to help you immensely when it comes to step two, as well as your preclinical years, which we'll talk about. For step one specifically, what I used for practice questions was primarily UWorld. I felt that UWorld was the most kind of comprehensive kind of question bank. The NBME exams I thought were fantastic for kind of replicating a little bit more of like that test day, what you're expected to know. They're created by the people who write the step one tests as well. So I thought the NBME exams were fantastic. UWorld, though, I thought was a little bit tougher. And I felt like that was good for me to be able to practice. My philosophy is I'd rather be challenged when I'm doing my practice than on test day. I'd rather have test day feel easy for me. And so I think doing that UWorld really helped me strengthen my foundation, getting ready for step one. AMBOSS and USMLE, I'll talk about where I kind of integrated all of this in just a second, but AMBOSS and USMLE RX I thought were great resources kind of earlier on in my studying path. And I felt like it helped me build that fund of knowledge before I went into UWorld and NBME to really kind of hone in my test taking abilities. For content, I think I relied on all of these throughout my preclinical years. So starting my M1 year, Anki, I thought was a fantastic resource to help me kind of keep all this material fresh in my mind. Medical school is a lot of material. You're essentially drinking from a fire hose. There's just so much stuff that you're expected to know. And Anki for me helped kind of start all of that in a digestible way, and then add on more and more cards as I went through my first 2 years of medical school. And through that, I was able to kind of keep it all fresh when it came to step one, as well as step two time. And it made it a lot easier for me to go into the practice questions without feeling that I had to relearn a lot of the material. So Anki was definitely a time investment. It took up a lot of time, but for me, I felt like it was definitely worth it. First aid is kind of like the best overall resource in terms of an outline of what you're expected to know for step one. Pretty much everything you're expected to know for step one is in first aid in some way, shape, or form. But for me, first aid was a little bit difficult to digest in terms of learning the material. I felt like it highlighted the bullet points, but it didn't explain to me why certain things happened. And so for that, I felt like Boards and Beyond and Pathoma were really amazing resources to really tell me, why is this actually happening in COPD or in heart failure? What is actually going on so that I can understand it? And so I don't feel like I'm memorizing just random facts that I won't be able to remember in the future. So that's kind of how I integrated kind of those study resources. And for Sketchy, I felt that micro and farm were the most kind of beneficial for me and the highest yield in terms of the amount of time I spent and the value I got out of it. I felt that integrating Sketchy with Anki was probably one of the best things that I was able to do for myself, because throughout medical school, as well as step one and step two, I didn't feel like I had to study micro or farm too much, because I kind of remembered the images. And honestly, even sometimes during my clinical rotations, when we're talking about antibiotic stewardship and kind of discussing what antibiotic we can use for a particular patient, sometimes I would straight up say, I remember this picture from Sketchy, and the residents, not the attendings, but the residents would understand what I'm saying. And like, we would talk about that sketchy image together and figure out, does this antibiotic actually cover the microbe that we're looking for? And so I thought, Sketchy was truly an amazing resource for me to be able to learn the material really well, but also kind of connect with a lot of the people I worked with during my clinical rotations. And so I'd highly recommend those two kind of sketchy content areas. In terms of my timeline, pretty much everything you're doing throughout M1 and M2 year is helping build for this step 1 exam. And so for me, my M1 year started in about July of 2021. And most of that year, I was just doing my studying. I was just doing my studying for M1 year, and I was continuing with the content review. For my school, we started with like a lot of the foundations where we looked at immunology, microbiology, pathology, some of the basic stuff that we need for the rest of the course. And we had a systems-based course. And so after foundations, we went into hematology, then MSK, then neurology, then cardiovascular and pulmonology. And so during that M1 year, I learned a huge amount of what's covered in step 1. But while I was doing cardiovascular and pulmonology, I was still reviewing neuro, MSK, heme through Anki. And so that really helped me kind of keep it all fresh when it came to my M2 year, when I started integrating some practice questions, specifically AMBOSS and NVME, and trying to do all of them, not just what we were studying for that specific block, but also spending, an hour a week trying to do one block where I'm looking at everything, all types of practice questions, rather than just that one system that we're learning in school. And so I felt like that really helped me come December, January, when I was really into that UWorld NVME focus, kind of doing comprehensive questions, not knowing that the next question is going to be MSK, because I felt like that made questions a little bit easier. If I knew I was in cardiovascular, I would only be thinking of cardiovascular causes of edema, for example. But as you guys all know, liver pathology can cause edema with a decrease in albumin. Kidney pathology with nephrotic syndrome can also cause edema. And so if the patient had edema and I was doing a cardiovascular block, I would automatically think heart failure. But when I do all of the systems together, then I have to actually critically think and figure out, is this heart failure or is this a different pathology? And so kind of going back to that really helped me kind of solidify my understanding for a lot of these questions. February was when I kind of did my dedicated, February and early March was when I did my dedicated step 1 prep, where I really focused on UWorld and NVME. And then in March was when I took my actual test. My M3 year, my third year of medical school, where I started my clinical rotations, started in like the first week of June. And so I actually had about a 2-month break after step 1, where I had the opportunity to kind of study ahead for step 2, which I thought was really great in terms of doing well on my shelf exams, as well as impressing my clinical preceptors by kind of having some of that baseline clinical knowledge because of the studying. It also gave me a chance to work on research and kind of enjoy vacations as well. And we can talk a little bit about when to take step 1 and things like that a little bit later. Now, the biggest thing I wanted to talk about was my approach to questions. I think in 30 minutes, there's not too much I can teach you about step 1. There's just so much content. There's not much I can do to improve your score. This is one thing that I think I can do that I think will be worth your time. The way I approach questions is that there's 2 things that come together for getting the question right: actually knowing the material and then test taking ability. I think they go hand in hand. I think at some point, the amount of knowledge you have starts to plateau in terms of how much it's going to help your score. The test has a total of 280 questions, but you're expected to know tens of thousands of different topics. So knowing more and more individual topics may not actually reflect to a higher and higher score at some point, right? As you're building on, more knowledge is definitely going to yield a higher score. But as you get towards the end, just adding knowledge is not necessarily going to translate to more score. Test taking ability and being able to sit down for 7 hours, take that test, critically think about each question and figure it out. What is the right answer? Even if you might not know all of the content in the question, is the second component to getting questions right. And I think they have a synergistic relationship. If you can kind of master both and kind of get both to the highest level you can do, you can really optimize yourself for test day. And so for me, my approach to questions is thinking like the question writer. Every single word that they put into the question stem has a purpose. Sometimes these things are long, right? So sometimes we just gloss over it. We don't put too much thought into it. But if you actually take the time to look at each and every word, there's a reason why it's in there, and it's to help include or exclude a specific answer choice later on. And the reason why I think this is so valuable is because I genuinely believe that if anyone was given an unlimited amount of time, you can get every single question right, just being incredibly methodical and going step by step, finding a reason to eliminate each and every answer choice. For example, when you're thinking like a question writer, your first thought should be, what do I need to give the student in order for them to pick A as the answer choice? If they want to pick myocardial infarction as the answer choice, what do I have to tell them? Well, I probably have to tell them that the patient has chest pain, maybe that it's radiating to the left shoulder. But there's other things I can include. I can include a history, right? I'd probably say that the patient has a past medical history of maybe hypertension. Maybe they have an increased BMI. Those things are going to make you start thinking this is cardiovascular in nature, or maybe neurologic in nature. It's some sort of ischemic process. It's probably going to make you think less of something like costochondritis, which might also present with left chest pain, because if a patient has cardiovascular risk factors, the test writer is probably trying to get you towards a cardiovascular diagnosis and not a musculoskeletal diagnosis. And so just thinking of what does that question writer need to write or need to tell me to be able to pick something as an answer is probably one of the most important kind of techniques that I think can be helpful. Now, during practice, I always recommend kind of starting slow, taking your time with questions. It's okay if you take more than 3 minutes for a question because you're really going through it. Because as you maximize your accuracy, you can start to build that speed. If you try to build speed too early and you're scoring less than what you want, then it's going to be a little bit harder for you to increase that accuracy over time. Speed can come quickly because as you figure out your process and how you kind of approach questions, you're going to become a lot faster at it and more efficient at it. By test day, the recommended kind of time period I give is about a minute a question. You're actually given 90 seconds per question per NBME, 40 questions, 60 minutes. But I like keeping 1 minute as just a standard rate because it's easy to look at the time and say, I'm on question 20, I have 40 minutes left. I've been doing 20 minutes a question or 1 minute per question for the past 20 questions. It's just easier to do the math instead of trying to figure out what 90 seconds per question is when you're 30 questions deep into your practice set. I also feel like it's helpful to have just a little bit of buffer. When you get to question 35 and you're like, oh, this one's a tough one, you can give it a little bit more time because you've built in that buffer for yourself. And so my recommended pacing is typically a minute per question. In terms of knowledge, how I recommend building that knowledge. For me personally, I'm a very simple person. I think understanding things at the most simple level is actually the easiest. I feel that we often overcomplicate medicine. We use big words. And I'm not sure if that necessarily helps when someone's studying. And honestly, the goal of what we're studying hard so that we can improve patients' lives in the future. And to do that, we need to be able to explain to them what they have. If we're only able to use big doctor terminology, how are we going to be able to convey to them what's going on? I think being able to talk in a very simple way without trying to confuse the patient, without trying to confuse yourself as you're studying, is one of the most important things to actually building that fund of knowledge. That's the way I was kind of taught one of my favorite professors, he taught anatomy, and he made things incredibly simple. I would look at a textbook before his lecture and I would think, there's no way I can study this. Like, it's just so confusing. There's so many nerves, like stuff's going everywhere. The words are so big. Like, might as well not try this. Being a surgeon's too hard. It's not worth it. But the way he would explain it, the way he would break it down, and the way he would use simple terms, he wouldn't use the actual medical terminology. He would teach us how that terminology was derived, right? How was this term used? It's because this nerve innervates this muscle, and that's why it's given this term. But it goes lateral to this bone, it goes medial to this, and so it gets these other prefixes that make the word look longer. If you look at it, it's actually pretty simple. Same thing applies for things outside of anatomy when we come to simple graphs or medicines or treatments or even complex physiology. If we really break it down and just think of the core, I think medicine in general can be incredibly simple. And that's the way that I like to teach. When I go through things, I like to focus on what is the simplest way we can get this across. For me, one of the hardest things I had difficulty with understanding, one second. I had a tough time for step one and for step two, really understanding and getting the right answer for things like developmental hormones. So whether it was puberty related, whether it was menstruation related, or whether it was like congenital adrenal hyperplasia, or like those either hyperandrogen or hypoandrogen states. For that and the enzyme deficiencies, I used to always try to memorize, if this enzyme deficiency happens, what are the 10 things that happen to the patient? And I used to always get so confused. But then really focusing on step one and step two, I told myself, I'm going to prioritize learning this. I identified this was one of my weaknesses. And I essentially gave myself about 3 to 4 key kind of definitions, saying that if this enzyme is elevated, it leads to this physical finding. And I think just having 3 to 4 of those allowed me to work my way through every single one of those problems. Before, I used to get scared every time it said which of these enzyme deficiencies happen when the baby boy presents with a clitoris or something like that. It made it very difficult for me to like kind of walk through those questions, and it kind of scared me a little. I was like, this is going to be a tough question. I might as well flag it and then come back to it later. But giving myself kind of 3 or 4 guidelines, saying I only need to know these 3 things. And if I can simplify it down to these 3 things, I can get every single question right. And so just taking complex topics and getting it down to the basics is what I highly recommend. And it's something I think will be very valuable, both for step one studying, as well as when you go into the clinic, when you're in the hospital or you're in an outpatient clinic and patients have complex pathologies, trying to break it down into the very basics and being able to explain that to both the patient as well as your resident fellow or attending that you're working with is really going to be able to impress them. Now, finally, how all of this helped me. I felt that my approach to step one, my plan for step one, it really helped me minimize the amount of time I spent studying. I felt that I was able to study a little bit more efficiently, take the test a little bit earlier, and I was also able to focus on understanding. And I mean, that led to great scores, but it also led to me being able to provide better patient care during my clinical years, whether it was my M3 year or in my M4 year, which I just started, just completed one of my sub-Is, and I'm going to start another sub-I next week, being able to really take care of patients with the knowledge that I accumulated, as well as being able to impress whoever I was working with, getting strong letters of recommendations. All of those things came from being able to really learn the material and understanding it. It also allowed me to spend more time doing things like research and going on vacation, spending time with my friends and enjoying myself. Med school is very tough, and so it's incredibly important to spend time doing the other things outside of just studying, looking at PowerPoints, doing practice questions. You have to make time for yourself. And so I felt that overall, being able to do these things allowed me to kind of perform better, but also have time for myself and be a little bit happier. And so I would love to be able to share more of this information with you guys, but I'm going to hand it over to Kartik now to talk a little bit more about the doctor journey.
Hey guys, it's Kartik. Just in case I didn't introduce myself, I am an M4. I'm also in Bugwood's class. I've scored over 250 on my step 2. So the doctor journey, as you guys know, we offer you guys accessible, affordable, and achievable medical education. You guys are going to get some free resources on the next slide, so stay tuned. But what we offer currently on our website is a lot of free resources already. So if you go on there, we have a step 1 schedule. You can download it for free. We have a step 1 correction tracker. We have a bunch of other things on there that you guys can use. And if you go in the resources tab on our website, it also has a couple YouTube videos that are very helpful and help you study for your step 1. So our goal is just make sure that your step 1 studying is the easiest it can be. And then on top of that, we do have some paid tutoring programs. I'm going to briefly go over them. One of them being group tutoring. We offer a 5-session group tutoring with an individual like Bugwood, a 99 percentile scorer. He's going to go over high yield topics in all 5 sessions, going to go over basically all the high yield stuff you need to know in step 1 within 5 sessions. You guys are going to get an individual study schedule. You'll get 24/7 tech support during the time period. And you'll get peer-to-peer support. You guys will have peer-to-peer groups where you can motivate each other and make sure you guys are studying well. Now, this is 250 for now, but wait till the next slide. Individual tutoring, we'll go back 1 minute. Individual tutoring, we also offer, it's same thing as group tutoring, but we make it personalized to you. And this is all customizable, all based on you. And again, this is taught by master tutors like Bugwood. We have a few others as well, all within the 99 percentile scoring, and we guarantee you a pass. You can go into our website for our guarantee as well. Next slide, please. But wait, for the first 4 people on this webinar who click on that QR code, we are offering 4 people free group tutoring sessions, and we're going to go through 2 free sessions of group tutoring. All we ask is you just fill out a review form after you're done with those 2 free sessions. We're going to make sure you guys get taught properly how to study, get some good high yield content, and get experience with how a 99 percentile scorer thinks. For the remaining people who fill out the form, you will be given $100 of total credit for anything you purchase in our website for future purchases. So if you guys are interested, we are offering free tutoring. Just scan the link below, fill out the form, and the first 4 people will be getting free tutoring guaranteed, and the next people will get $100 off checkout. And then we also have referral programs and review forms that help bring the cost down to $0 because we want to make medical education accessible, affordable, and achievable. We don't want you guys spending that much money, and we just have to pay our tutors for their time that they take out of their 4th-year med school, their residency, or attending status that they are. So we want to make sure that everyone is happy, and we want to help you guys succeed, and we guarantee you guys a pass on your step 1. And thank you guys for listening. Now let's move on to some questions. Any questions you have for us, you can ask Bhagwat, you can ask me. We're here to answer.